Assalamu alaikum. So far, we have finished two parts of the anti-metabolite agents. The first one dealt with the inhibitors of the cell wall synthesis, and it involved the medication called beta-lactams, like in the case of penicillins, cephalosporins, cefamycins, monobactams, carbamazepines, as well as non-beta lactams, like in the case of vancomycin, and finally the use of beta lactamase inhibitors, the clavulanic acid, and the likes. The second part dealt with the antibacterial agents that are protein synthesis inhibitors, whether on the 50S or 30S ribosomal part of the ribosomal complex, and it involved the aminoglycosides, the tetracyclines, the macrolides, the chloramphenicol, the lincosamide, the streptogramins, and unfortunately, we did not cover the linezolid. And the final part is about the antibacterial agents that inhibit the nucleic acid synthesis, whether indirectly or directly. We will start with the anti-metabolites. And why they call it anti-metabolites? Because they're resembling indigenous metabolites, and they're blocking the synthesis of nucleic acid synthesis through resembling indigenous substances. Before we go any further, I'd like to show you this scheme representing the synthesis of the active form of folate. The active form of folate is called methylene tetrahydrofolate, and it is important for amino acid synthesis and the purine synthesis, as well as the thymidine synthesis. In the thymidine synthesis, it converts the uracil into a thymidine by giving one carbon. So the difference between uracil that is used in RNA synthesis is different from thymidine that is used in DNA synthesis is a one carbon atom, and that's it. So the methylene tetrahydrofolate is a donor of that one carbon to convert uracil into thymidine. If there is no thymidine, then there is no ability to replicate DNA. If there is no ability to replicate DNA, the replication and the growth of the cells will cease, will stop. The cells are not growing anymore. And we have, with this regard, two pathways. A pathway that is only present in microorganisms, but it's not present in humans, and the other part is present in the microorganisms and humans as well. In the first part, para amino benzoic acid and the precursor of a pyridine ring will be combined by an enzyme called dihydropyridine or pyruvate synthetase, and then glutamate will be added to form dihydrofolate. So we can say that the dihydrofolic acid is consistent of three major parts: the glutamate, which is an amino acid, the para amino benzoic acid, and the pyridine precursor. The second part of the reaction that happens in all creatures, in humans as well as in microorganisms, the dihydrofolate will be reduced to the active form of folate called tetrahydrofolate utilizing an enzyme called dihydrofolate reductase. And then the active form of folate, which is methylene tetrahydrofolate, is being involved in amino acid synthesis, purine synthesis, and thymidine synthesis. Without the thymidine synthesis, the cells will die in something called thymineless death. So we have a group of compounds called sulfanilamide. An example of them are sulfonamides. They inhibit the enzyme dihydroteroate synthetase, and this will stop the synthesis of the dihydrofolate. We, the human, we do not synthesize our own folic acid. Rather, we get it from the diet or through the microorganisms in our intestine as part of the normal flora. Theoretically, sulfanilamide and sulfonamide should have no effect whatsoever on humans because this whole step, this whole step is not needed for a human. Humans contain, as well as other creatures, they have the dihydrofolate reductase that will reduce dihydrofolic acid into tetrahydrofolic acid, which is the active form of folate. A trimethoprim is anti-metabolite because it resembles the dihydrofolate. Sulfonamide is an anti-metabolite because it resembles the para-amino benzoic acid. This is the chemical structure of a sulfonamide, and this is the chemical structure of the para-amino benzoic acid. And you can see the similarity between the two chemical structure, and this is where the anti-metabolite come from, since trimethoprim resemble the folate and the sulfonamide chemically resemble the para amino benzoic acid. Classically, the sulfanilamide or the sulfonamide are bacteriostatic. If we combine the sulfonamides with the trimethoprim, the resulting effect is synergistic and it is bactericidal in combination. This is the chemical structure of the folic acid. This is the pyridine ring. This is the para amino benzoic acid, and this is the glutamic acid. The met, the trimethoprim resemble the structure of folic acid. The sulfonamide or the sulfanilamide, they resemble the structure of the para amino benzoic acid. This is the structure of the trimethoprim, that is dihydrofolate reductase. So we have two groups of medications that are indirectly nucleic acid synthesis inhibitors. As well, they are anti-metabolized, the sulfonamides and the trimethoprim and the trimethoprim like agents. As I said before, sulfonamides are bacteriostatics and they resembling the para amino benzoic acid in chemical structure, and that's why they inhibit the pyruvate synthase enzyme. In theory, we should not be affected by sulfonamide at all because we get our folic acid either from the normal flora in our intestine or from the nutrient, the food that we eat. The sulfonamides are sub-classified into three major categories. Those that are applied topically, like sulfacetamide and silver sulfadiazine. In Jordan, we don't have the sulfacetamide that is used in ocular preparation, eye preparations, and we have the silver diazine that is used in burns cases, حالات الحرق. So we don't have sulfacetamide, rather we have only the silver diazine in preparation intended for the alleviation of the cases of burns. The second class of sulfonamides are those medications that are taken orally, but we are not using them for their systematic infection. And this include a product that is called sulfasalazine. And sulfasalazine is consistent of two different compounds. One of them is called sulfadiazine, which is an oral non-absorbable sulfonamide, and the other is 5-amino salicylic acid. The 5-amino salicylic acid has anti-inflammatory activity. The sulfadiazine, when it is combined to 5-amino salicylic acid, is called sulfasalazine. And sulfasalazine is one of the most important medications used in the management of inflammatory bowel diseases like ulcerative colitis or Crohn's disease. اسمهم بالعربي أو بيحكوا لهم التهاب الأمعاء التقرحي المزمن. And this sulfasalazine, the active moiety in it is not the sulfadiazine, rather the 5-amino salicylic acids. The oral absorbable subclass of the sulfonamides are further divided into short-acting, intermediate-acting, and long-acting. Sulfa-isoxazole short-acting, sulfa-methoxazole long-acting, and sulfa-doxine long-acting. In Jordan, here we have only sulfa-methoxazole, and it is not used by itself alone. Rather, it is used in combination with trimethoprim, the product containing sulfa-methoxazole, and the trimethoprim is called cotrimoxazole or cotrimox in abbreviation. This cotrimox has a synergistic activity because it contains para-amino benzoic acid analog, which is the sulfa-methoxazole, and the folate dihydrofolate reductase inhibitor, the trimethoprim. The combination of the two subsequential steps results in synergistic bactericidal activity, and it has a lot of indications. One of these indication is in the management of pneumocystic carini in immunocompromised individual. Pneumocystic carini is an opportunistic pathogen that only causes abnormality in patients with reduced immunity, like in the case of patients with AIDS. Another use for cotrimox or cotrimoxazole or sulfamethoxazole trimethoprim is in the management of toxoplasmosis. And toxoplasmosis is infection that is transferred from animals, specifically domestic cats, cats that are raised inside the house, to pregnant women. And it's a small opportunistic pathogen that will find its way eventually to the brain, causing a serious medical ailment called toxoplasmosis. And in this case, they use a combination of a sulfonamide, which is sulfasalazole, as well as a folate dihydrofolate reductase inhibitor, which is the pyrimethamine. The trimethoprim specifically inhibits the dihydrofolate reductase in prokaryotes like E. coli, while the pyrimethamine specifically inhibits dihydrofolate reductase in parasites. Still, this selectivity is a relative issue. With continuous use and with high doses, the dihydrofolate reductase in humans will be affected. And this will lead to side effects in the hematopoietic system. in the RBCs and in the white BCs in the red blood cells, resulting in in megaloblastic anemia, and in the white BCs, resulting in leukopenia and granulocytopenia. The use of sulfonamide in theory should have no effect whatsoever on a human. Still, in practice, we find that patients who are taking sulfonamide, they suffer from hematopoietic abnormality, which is a megaloblastic anemia, folate deficiency anemia, and they suffer from something called kernicterus. And kernicterus is a condition where the bilirubin bound to albumin in babies in their mom's wombs, the infants in their mom's wombs, the bilirubin that is bound to the albumin will be displaced, will be kicked, will be the place where the albumin, where the bilirubin is bound to on albumin, will be taken preferentially by the sulfonamides, and this will lead to an increased level of bilirubin in the blood, with subsequent deposition of this excess bilirubin on brain soft tissue, resulting in mental retardation. That's why the products containing sulfonamides alone or sulfonamides in combination shouldn't be given to pregnant mom, especially in their third trimester, the last third part of their pregnancy, in particular when it is close to the delivery time, to avoid the connecticus tissue connecticus problem. Sulfonamides as well causes hepatic dysfunction and an array of other side effects. This is the list of clinical uses of sulfonamides, where sulfadiazine and pyrimethamine are used for the management of toxoplasmosis. This is not available in Jordan, and the sulfa isoxazole in addition to sulfa metaxazole are used for the management of UTI, and this combination is present in Jordan, and it is called cotrimoxazole or cotrimox, and it is one of the excellent choices for the management of simple UTI in females, because this combination in females and the prostatitis in males, which is the infection causing inflammation in the prostate gland in men, and the UTI in female. And this is because of the distinguished activity of Cotrimox against E. coli, Escherichia coli, and other gram-negative bacilli. This is because the most common causes of UTI in females comes from the fecal contaminant with E. coli and other gram-negative bacilli belonging to Enterobacteriaceae family. Topical agents contain sulfacetamide in ophthalmic preparations. We don't have it in Jordan. And silver sulfadiazine that is used for the management of burn wounds. Regarding the oral non-absorbable agents, the agent called sulfasalazine, it is a chemical combination between sulfapyridine from the sulfonamide and 5-amino salicylic acid. The anti-inflammatory activity of sulfasalazine is attributed to 5-amino salicylic acid and not to the sulfapyridine. And the sulfapyridine in this case is only used as a carrier of 5-amino salicylic acid to its target site in patients suffering from ulcerative colitis or Crohn's. Also, Other people suffering from rheumatoid arthritis can also use this medication as part of their disease modifying course of management. The side effects of the sulfonamides are plenty. Part of it because of hypersensitivity to the sulfur products. And unfortunately, there is a cross allergenicity between sulfonamides, the antibacterials, and the sulfonylurea oral hypoglycemic medications, and the thiazides, the antihypertensive medications. So it is expected that patients with allergy to sulfonamide antibiotic may be seriously having hypersensitivity issue if they have diabetes and they are taking one of the sulfonylurea, or if they have hypertension and they are taking one of the thiazides. They have hematological toxicity because they causes a granulocytopenia, aplastic anemia, and the thrombocytopenia. In patients with G6PD deficiency, glucose 6 phosphate dehydrogenase deficiency, they have oxidizing potential sufficient to causes hemolysis of the RBCs. Unfortunately, they have the sulfonamides, they have low water solubility, and this may result in crystalluria, which means that is the crystals of sulfonamides will be formed in the renal tubule, causing physical damage to the renal tubule. That's why it is recommended to drink plenty if of fluids and to try to alkalinize the urine using sodium bicarbonate when you are taking sulfonamide. And as has been explained before, that women who are pregnant and they are close to delivery time, and women in general who are in the last trimester, in the last third of their pregnancy, so should not take sulfonamide containing products because of fear of a kernicterus. And the kernicterus is the condition where the bilirubin that is bound to the albumin is being displaced by the sulfonamides, resulting in precipitation on the brain soft tissue with subsequent mental retardation problems. The trimethoprim, as we said before, is something that resembling the dihydrofolate. That's why it's an anti-metabolite. It inhibits the dihydrofolate reductase, the enzyme that is in charge, the enzyme that is responsible for the production of the active form of folate, which is the methionine tetrahydrofolate. The side effects associated with trimethoprim are extension from the is expected from the mechanism of action. They inhibit the activation of folate. Folate is needed in RBC production or needed in white BC production. That's why they cause megaloblastic anemia, leukopenia, uh, granulocytopenia. How we can minimize the side effect is by the provision, addition of the active form of folate, which is called folinic acid. Folinic acid is another active form of folic acid called 5-4-meal tetrahydrofolate, which is a synthetic one. The natural the natural active form of folate is methylene tetrahydrofolate. This is 4-meal, and the natural one is methylene. So methylene tetrahydrofolate is the active form of folic acid inside our body, and folinic acid is 5-4-meal tetrahydrofolic acid, which is equivalent as the active form of folic acid. We said that when we combine trimethoprim with sulfamethoxazole, we get a product called cotrimoxazole, and it has a synergistic activity leading to bactericidal activity against susceptible organisms. The adverse drug reactions are expected to be the same side effects as those of sulfa products, as well as the side effects of the trimethoprim. The uses of cotrimoxazole or sulfamethoxazole and trimethoprim are the normocystic carini in AIDS patients and other patients with immunocompromised condition. The management of UTI because of their selective activity against E. coli and other Enterobacteriaceae family. They have activity against H. influenza. They have activity against the Legionella atypical microorganism. H. influenza is a gram-negative bacilli. Also, they can be used in the management of shigellosis and in the management of the carrier state of salmonella. They could be used as an alternative in the case of listeria monocytogenes pneumonia in patients who are allergic to the activity of penicillins. As we said before, listeria could be causing meningitis in newborn less than a year and more than a month. The most common utilization of cotrimox is in the use of UTI and prostatitis because of their distinctive activity and excellent concentration achieved in the renal fluids and the prostate site. The last group that affects the DNA synthesis are called the fluoroquinolones, and they are direct nucleic acid synthesis, and they have different generations. The sequence of activity of against a gram-positive bacteria and a gram-negative bacteria is quite different from the one we see in cephalosporins. As the generation of fluoroquinolones go on, the activity against the gram-positive increases, and the activity against the gram-negative bacteria goes down. The first one was norfloxacin, and then we had ciprofloxacin, then we have levofloxacin, moxifloxacin, gatifloxacin. The respiratory fluoroquinolones are the fluoroquinolones that have the highest concentration in the lung, and they are the levofloxacin, gatifloxacin, and gemfloxacin. They have the highest concentration there, and that's why they are recommended in the case of pneumonia or in the case of COPD exacerbation, chronic obstructive pulmonary disease exacerbations. And this is because of their highest concentration in the respiratory tissue. The levofloxacin has a bioavailability that is almost 100%. The ciprofloxacin has a bioavailability around 80%. These agents have excellent activity against gram-positive, gram-negative aerobes and anaerobes, and anti-pseudomonal activity, which is an important character of this group of medications. The mechanism of action of these agents, they block two topoisomerases, topoisomerase 2 and topoisomerase 4. The inhibition of the topoisomerase 2 would inhibit or would stop the relaxation process during the replication process, and this will stop the DNA and the cell from proceeding in the replication process. The topoisomerase 4 is in charge of the separation of the replicated chromosomes into the two different daughter cells. These agents originally were designed to have activity against gram-negative aerobes, but with time, newer generations of fluoroquinolones regained activity against the gram-positive bacteria, aerobes, and some of the anaerobes. The newer generation of fluoroquinolones, they have distinctive activity, regained distinctive activity against the gram-positive bacteria, like the case of levofloxacin. The classification of these agents is important because the earlier versions of fluoroquinolones, like in the case of norfloxacin, are mainly gram-negative bacilli. And as we proceed with the generations, more and more activity against the gram-positive bacteria can be seen. One of the most important clinical uses of fluoroquinolones is in the treatment of complicated UTI, especially if caused by multi-drug resistant bacteria like Pseudomonas. The management of infectious diarrhea caused by Shigella, Salmonella, and toxigenic E. coli, as well as Campylobacter, are some of the most important uses of fluoroquinolones. A nice thing about the fluoroquinolones that they have a very large volume of distribution, allowing them to work in different sites of infection. The clinical uses of fluoroquinolones can be used in the management of anthrax, like in the case of ciprofloxacin, in the case of chlamydial urethritis or cellulitis, in the case of ciprofloxacin and levofloxacin, and that the respiratory fluoroquinolones, levofloxacin, gatifloxacin, gemfloxacin and moxifloxacin for the upper and the lower respiratory tract infection, and the ciprofloxacin, levofloxacin, and moxifloxacin. Sometimes they are used for the management of tuberculosis and atypical mycobacterial infection. They have phototoxicity, like in the case of tetracyclines. They damage the connective tissue, the tendons. We said when we discussed tetracyclines that they cause mottling and abnormality in the growth of the bones and the teeth of the newborn. A similar side effect can be seen with the fluoroquinolones, where they cause tendonitis, inflammation of the tendons, and a breakdown and damaging of the cartilage, as well as the QT prolongation, especially with the gatifloxacin, levofloxacin, gemfloxacin, and moxifloxacin, which are the respiratory fluoroquinolones. The QT prolongation is also a distinctive side effects of the macrolide antibiotics, specifically those of erythromycin and erythromycin. Here we this by reaching this point we finished everything regarding the antibacterial agents. We finished in the first part the antibacterial agents are targeting the cell wall synthesis, and in the second part the antibacterial agents targeting the protein synthesis, and in the last and the third part we finished talking about two classes of medications affecting the nucleic acid synthesis, the indirectly acting and the directly acting. The indirectly acting are the sulfonamide and the dihydrofolate reductase inhibitors, the trimethoprim, and the directly acting, the fluoroquinolones. يعطيكم العافية.